All right, good afternoon from Santa Clara University. We are here for the first ever Share My Summer Internship panel. And we have two students here now. Another one's going to join us in just a few minutes. And all three of these Santa Clara students have done an internship with Health Careers Connection this summer. And two of them are former students of mine. One I've met today, who I'm glad to meet, Deja Webster. And Daisy Alvaran is on the end down there. And Deja is going to go first. I have some questions that I'm going to ask to make this a lively session, but I also want to appreciate our facilitators here. So Shannon Keeley, our public health librarian, who made this all technologically possible, because it's certainly above my skill level. And I'm just a faculty member. And Christina Kwan, who works in career advising here at the university, has also been part of our gang of conspirators to start off this panel series on internships. So students can share with one another what their experiences have been for everybody's mutual benefit. So with that, I'm going to ask, I have a few preset questions which the panelists have seen, and I'm going to use those to lead off the discussion. We're going to go one by one and start with Deja. So what is the formal name of your internship?
The formal name of my internship is a student intern within the Office of Professional Excellence and Inquiry, which has just recently changed. Originally, they were called the Office of Nursing Excellence, and it's basically the administration network of the nursing staff of Lucille Packard Children's Hospital. So I'm actually working within that network,
Okay.
and that's the professional title.
Okay, great. And you're a rising senior.
Yes, so a little bit about my background. I'm a rising senior at Santa Clara University, and I'm majoring in sociology, and I'm doing an individual studies major that I'm calling health policy and organizational leadership. And I also have a minor in Spanish. And so I got interested in public health from the beginning, but I took the route of trying to maybe work behind the scenes in administration rather than up front as a clinician. So Lucille Packard Children's Hospital was a really great avenue for me to get some experience in administration, in this case, hospital administration, which is just one sector of the healthcare administration field.
Great, that's a wonderful intro, and I appreciate you picking up my hint so readily, because I should have asked you to introduce yourselves all first. So, hey Taylor. So we have a member of the audience. Taylor is not a panelist today. Maybe she will be in the future, though.
We'll see.
Yeah, so Taylor is one of my Public Health 2 students. Deja, let's go with the next question on the list, which was, how did you hear about Health Career Connections?
Well, I originally got wind of Healthcare Connections through the public health department. It was an email alerting students to of color and of minority to look out for this organization that hosts students to healthcare career jobs.
So you heard about it from an announcement from the Department of Public Health Sciences?
Yeah, via email.
And you were on the list or something, the listserv there?
Yeah, all public health student. I was originally a public health major in the beginning.
Oh, okay.
So honestly, I found it really helpful that I was still on their contact list, because even though I wasn't a public health major, I was still interested in the content.
Okay, I thought maybe you heard about it from Aaron.
No, we just kind of ended up in it at the same time.
Mm-hmm.
So let me tell you the format. So what I did is I sent some questions ahead of time. Okay, just to add a little bit of structure. And so we decided to start with Deja, and we're going to go through the questions, and then Daisy, and then you'll be the follow-up. Okay. And we have a small audience here. We have a small audience from Brazil.
That's cool.
Yeah, so, and it's being recorded. So as our inaugural talk, it's a no-lose situation regarding the audience because there's going to be future audience as well.
Great.
Okay,
Cool.
so we're glad you joined us and you're in one piece.
Yeah.
Okay, all right. So here's another question involving this internship. Did you have much choice in where you did your internship? So as I understand it, you get interviewed by Health Career Connections and you're accepted as a person who's going to participate. Did you then have choices about what organization you would work with?
No, they place you into the selected host organizations. However, I don't think it's a random placement. I think they really take the time to look at your application and what you're interested in, and then they pair you to the best fit. The pairings can either be one host location or up to 3. In my case, I was only paired with 1, and I was accepted into that one, but you can go on as many as 3 different interviews at 3 different sites.
Okay, all right, great. So once you were matched with a host organization, did you have many options regarding what assignments you got? Or did they pretty much tell you, here's what we need you to do this summer?
Well, in my case, at Lucille Packard Children's Hospital, they assigned me work, and I feel like that's kind of where there's give and take in my internship, because although I'm assigned busy like data entry work or policy modification edits that are very like standardized and very clear instructions, it's not really me creating anything for the hospital. But what I do take from it is, the opportunity to shadow different jobs within the field. So my office is in the middle of, infection and quality control. It's in the middle of patient experience, family-centered care. So there's all these different links within hospital administration that I'm kind of getting access to. So although the work was not assigned to me originally, and my experience isn't really coming through, I'm not gaining experience through the work they're assigning me. I'm gaining experience through the ability to be able to shadow different professionals within the hospital administration sector.
Okay, so a lot of those are topics we talked about in Public Health 2 and a little bit in Public Health 1. Have you had those courses?
Yeah, I've taken Public Health Science 1, 2, and then SOC 172, Management of Healthcare Organizations.
So did your internship kind of echo some of the things that you heard in those classes?
Yeah, definitely. I think that hospital administration is definitely more localized, because all their efforts are put into improving the hospital. It's not really community based like we learn in Public Health 1 and 2.
Mm-hmm.
So although it's a little different, the overall content of the job is the same. They're making sure that there's quality, effective care is given, improvement measures, prevention measures, but it's catered towards the hospital.
That's a really interesting observation. So talking to the Health Career Connections people, maybe in the future, I might urge them to have more collaboration with community health centers, and maybe I can help them with that. Because Taylor came to a board meeting for a community health center recently and commented about how close to the ground floor it was at that board meeting, really in the community. So you're giving great answers. This is terrific. So did you get paid?
I did get paid.
Does everybody at Health Career Connections get paid the same thing?
No, I do believe it varies, especially Daisy works for Kaiser, and I know that Kaiser is hourly.
Actually, no, I was in a different Kaiser program. I was selected differently. Most of the interns who were working at Kaiser were with KP Launch, which is their own internship inside the hospital.
Okay.
But for me, I was selected differently. So I didn't get paid hourly, I got a stipend compared to the other KP employees.
And we'll come back to your experience. Do you mind, Deja, do you mind sharing how much you were paid?
I was paid, I think all interns are paid between $3,000 and $4,000.
Yeah.
So I was paid within that range. And that's something that I do think is very important. If you're working, I mean, free internship experience is great, or non-paid internship experience is great just to get that exposure. But I really do think that like students should try to seek pay, especially or negotiate some type of pay, because you are doing work and it shouldn't go unpaid.
Yeah, and to echo that, I know that a lot of jobs when you're applying, there's 2 former interns who interned at my organization, which is Valley Health Plan last year, and they work there now.
Yeah.
And they said a lot of job applications will require paid work experience. So I think having that, one for your own personal financial reasons, but also just for future jobs, it's good to have paid experience.
Yeah, and I mention it for 3 separate reasons. One is, so I've been involved with Health Career Connections indirectly as a donor and a supporter over the years. And I know that part of their original philosophy is these internships should be paid. Another point is that there's some legal issues regarding unpaid internships. It's getting riskier for organizations to do that. And they're probably better off, even if it's nominal pay, providing some pay, because you are working, Deja, as you said, right? And the third thing is that with the cost of university education, students usually need the money. So it's that you are working and there is an expectation that you're going to be showing up, doing a good job, making a contribution, then you should get paid. So I'm glad that's a decent level pay compared to some other internships that I know about. Okay, so can I go back to the questions list?
I just also wanted to know about the pay scale. There is a mandatory 10-week period. So I don't know the math, but you know.
I'm going to tell you, for me, it was a 40-hour week schedule for 10 weeks. That's 400 hours. So based on your stipend, you might be learning less than minimum wage.
Okay.
I know for me, that was the case, which I'll explain later when it's my turn. But I know for those who were in KP Launch, they got more than over minimum wage, very generously.
Yeah, it does depend on the organization. I know that some sites, I think it's pretty standard, but some of them do get paid hourly, which is more. And then I know some sites are qualified for certain grants or scholarships. And I think it's just, they say it depends on the organization, but I think that I would say more often than not, what Daisy's saying probably is true.
Yeah.
That they do have some sites that pay more, I think.
Right. Okay, so a couple more questions, 6, 7, and 8. So 6, what'd you like about your intern, Deja?
Oh.
You're still in the hot seat. What did you like about your internship and what did you not like about your internship?
I think there's many different pros and cons, but I think overall I'm there to gain experience, and you know, maybe a little frustration might come from because we are students, we have been doing work for going on 3-4 years, and we are self-confident in our work and we feel qualified to get things done. So kind of I feel like maybe a little bit assigning just busy work or work that you don't feel like you're maximizing your full potential at, or you could show really what you've learned in school. So I think that might be, the biggest con of my internship, just really wishing that they gave me a little bit more, more of a chance to show, what I can do and what I'm capable of, and, how I can really be an asset to their company.
Mm-hmm.
And then, as I mentioned before, I think a huge pro for me is just being able to look at the different jobs within hospital administration, because each role requires different skill sets.
Mm-hmm.
And, if especially coming out of school and seeking higher education, you're really trying to build on one particular skill set. And so you kind of want to cater, what kind of skills you're learning to the position you eventually want to see yourself at. And so when I see jobs like quality improvement and I see how much they're using data analytics and like Excel and also leadership, that might be something I want to work on and gain experience on in the future. So a huge pro is definitely being able to shadow different people in policy, quality management, medical director roles, stuff like that.
That's great. Well, as it turns out so far in the survey that we've been doing on what courses students are interested in, and 100% of the audience has taken the survey, so, except you actually. Deja, to make sure you get the survey. Healthcare quality management is one of the more popular classes that people have identified as something they would like added to the curriculum. Given your experience this summer, do you think that'd be a good idea?
Oh yeah, I think that'd be a great idea. Quality is all about, like I said, data analysis, and really research is at the core of anything in healthcare. If you're looking at policy, if you're looking at just improving anything, you have to have baseline data. So
yeah,
I think that's a great idea.
Well, you've already answered question number 7, whether you learned a lot. So here's the last one. Do you feel like you made a contribution?
That's a difficult question at this point because I still do have 4 more weeks left of my internship.
Oh, you have a long time left, yeah.
So I have room to grow. I'm not the only HCC student on my internship, as well as we have other interns working at Lucille Packard Children's Hospital. So I don't want to say that I'm caught in the shadows, but they kind of clump us all together.
Mm-hmm.
So as much, I don't think I've made an impact as much as I wanted to. So I think that might be something to bring back to HCC is maybe not pairing 2, 3, 4 interns in one site, because that's kind of defeats the purpose of their program. You're supposed to, I feel like they want interns to gain that experience, that hands-on experience, and then like they promote, hopefully, obtaining a job afterwards.
Yeah.
Which is different for everyone, but yeah.
I think that's good advice, and I hope you do pass that back to HCC people, and I will too. This is a continuous quality improvement type process, so your suggestions, I'm sure, will be listened to, and hopefully the organization will respond to it. But there are a lot of different organizations across the board. So, well, I think I was quite justified in asking Deja to be the first speaker, because you did a wonderful job of explaining your internship. Karen, was that helpful to you in what you just heard from the first speaker about this internship?
Okay, Mark. Yeah, it was really good. It's good to have just like a better, like, broad idea of what it is like, because especially from being from another country, like, things work differently here. So what my Brazilian friends are going through is like completely different. So it's good for me to just learn a little bit more and like hear the perspective.
Right. Right.
Yeah, so yeah, that was really helpful. Thank you.
Karen, what year are you? Are you a rising junior?
I'm sophomore.
You're a rising sophomore?
Yes.
Something to add, and I didn't know this actually, but at HCC, if you can apply, I met people at one of our conferences that I think he just finished his freshman year in college, but if you're part of HCC, you can reapply to be an intern 3 times.
Yeah.
So if you're a graduating, college senior, and you don't have a job, then you can go back and be an intern 3 times if you want to. But if you get into the program early, I think that would be, having this experience 3 summers in a row, I'm assuming you have different placements, would be a really good experience. So yeah, that's a big deal.
And I have known people that did it the summer after they graduated.
Mm-hmm.
Well, I know one right down the road there. So again, thank you very much, Deja. That was helpful. So Daisy, you're next. So what I'm going to do this exact same thing. What's the formal name of your internship, and then do what Deja did and just kind of gracefully slide into an introduction.
Okay, so I actually have 3 titles only because my preceptor has a different title for me. The Kaiser Permanente department has a different title for me. And then next week I will receive a new title. So as my preceptor, she has me as an HCC student intern. Kaiser has me as TPNG administrative intern. TPNG stands for the Permanente Medical Group that strictly focuses on the medical offices, not the hospital side. And then my internship ends next week, and I got hired temporarily till the end of the year. So my new title is now TPMG Administrative Temporary Employee. So
Excellent.
that's why I said 3 titles. It's changing. And to introduce myself a little bit, I am a graduated Santa Clara student from the class of 2017. I ended up getting a bachelor's in public health. And I essentially just decided to do public health. I started with a biology major, but it wasn't really my strength, biology. And the public health department did a really good job in telling me that there are ways to help people without necessarily getting a biology degree and being a clinician. So kind of what Deja had said. And that's how my interest kind of peaked in public health. And the more I ended up taking the courses for the major, I ended up deciding that public health was the best fit for me, that I could help people. And that's kind of my goal.
All right. So how did you hear about Health Career Connections? Because I think you heard about it in a little bit of an unusual way.
So mine was really unique, I will say that. I don't think it happens very often. So from my high school, I graduated from Notre Dame High School in San Jose. I was asked to speak at a donor event to thank people who donate to Catholic education. And I had to introduce myself, say what my story was. And for me, I ended up going up to the podium and I spoke about how passionate I am about public health and what I can do with this major, because not a lot of people actually know about it. It is growing, I will say that. And Mama Cantos is the vice president of HCC, and she is an alumni from there. And she came up to me after the speech and said, look, I think you would be a great candidate. This is a great personal statement. This is what we're looking for our organization. Please give me your details. And I'm so glad she caught me out the door, because I was leaving literally, and she kind of chased me down. I thought she had already left because there's a lot of people there. And so we exchanged information. And then a week later, she tells me, come in for an interview. And she said, we'll fill out your application later. So I didn't even fill out the application at all. She said, it'll be based on your interview here at headquarters. And I said, okay. And going to that interview, you'd be surprised. It was very rainy. I was coming from school. My heels broke, but they saw that as me being really determined to get there and really wanting it. And of course, I went through the interview. I got another email the following week saying that I've become an HCC intern. And that's basically how I became
All
an
right.
HCC intern.
Very good example of, now what does Jeff Oxendine and other folks at Health Career Connections say? No network, no work. What's the phrase?
No work.
No network, no work.
Mm-hmm.
Yeah. So there you were out networking. You were doing something nice for your high school, and that turned into a terrific opportunity for you.
And that's something I want to say. If a professor, or in my example, if my principal asked me to come and speak, take it. You never know. This was a great networking event that I didn't think was going to be a networking event. I thought, oh, I'm just going to do a speech, and I'm very grateful to those who donate. But I really didn't expect this to happen. So, I would say always be prepared for the unexpected events.
Yeah, well, that's great. Or as they say from the part of the country that I'm from, if you don't get into the bowling alley, you can't roll a strike. So get out there, talk to people, and do something helpful like you were doing. So Did you have much choice? You answered that a little bit before about having some choice, or did Deja answer that?
I didn't have a choice in mind.
Okay.
So I had gone in and I had asked, after my interview with Kaiser Permanente, I asked Jose Miramontes, which is for the NorCal interns, if I would be eligible for another interview. But because I had done it so close to the deadline had already passed for regular HCC applicants. Mine kind of happened to be a special case where it was right before they were assigning internships to the already selected interns. So I didn't really have much of a choice in it. And to further broaden my prospects, I said I was willing to travel anywhere so long as I would get an internship.
Okay. Well, great. Well, I know Erin had some choice, so we'll cover that when she's up to bat. And you discussed this a little bit when we were chatting off camera before. So once you were matched with the organization, did you have any choice about what assignments you were given?
I was not given the option to choose what I wanted to do for my internship. However, I would say that my placement was strictly based on my resume because I had experience at the Health Trust aiding or being one of those interns to help homebound seniors. And that actually is what made my preceptor choose me other than coming in, because she had already interviewed another student and she wasn't really thinking about getting an HEC intern because she thought the project was really big. And considering her first interview wasn't very well, or the interviewee wasn't suitable, she decided to give it one more shot, and it kind of just bounced off of my resume that I had already experienced with homebound seniors, which was one of their focus groups for their project that they assigned me, which was safe outpatient mobility.
Wow, that's terrific. So it was a good match. So even though it was sort of real world like, you weren't necessarily telling your boss what you were going to do. Your boss had selected you and said, now that you're part of my team, this is what I need you to do.
Yeah, and here's the thing. She kind of gave me a lot of free reign to a lot of the things I got to do. And it can be scary and it can be exciting. So scary if you're someone who's really into someone giving you directions, or not constantly, but giving you directions and a lot of structure, then that would have meant your preceptor isn't really compatible with you. But for mine, my preceptor kind of goes along with what I want to do too. And it was, these are the goals that you need to achieve, and it's up to you to get there.
Right.
So she gave me a lot of free reign.
And that's actually, for us faculty, it's an issue for us all the time of whether how much we direct you or how much we help you with goal setting and let you explore around there a little bit. So
and I will add, that's the reason she also chose me. She said, you're a go-getter. So I would say, there's no limit.
she was an astute interviewer, wasn't she?
She was a little intimidating because she had already said, oh, I said no to the first intern. So I was a little intimidated that that would be the case, but we just got along so well because our personalities just clicked.
Well, that's great, but it was more than personality. So how much did you say you got paid?
I got paid $4,000, and that was working 40 hours a week. But here's the thing, for mine, I was selected differently. So I didn't have to clock in like other KP Launch employees had to. I pretty much just had to show up during the time that my preceptor had set. But she was very fluid with it. She's like, you can come in at 8 and leave at 5, take your hour lunch and your breaks. But what I did to be successful, at least in my internship, I worked through my breaks and through my lunches, which is what my preceptor had said not to do, even though she was doing it. But I did it anyways because that's how like most of my work ended up being complete. And I went above and beyond as what my preceptor had said. She said you don't have to do that, but she liked the fact that I was doing that because
she kind of liked that you went above and beyond expectations.
Yes.
Oh, yeah. That's a pretty popular thing among employers.
Yes.
All right, good. Let's see. Did you learn a lot?
I did learn a lot. I would say that it's a little complicated seeing how things aren't perfect. I would say sometimes, like for example, Kaiser Permanente, they do their best, but there's a lot of limitations within that company, especially for the project that I'm working on, which is safe outpatient mobility. There's the limitation that we can't help a patient out of their car into the medical office building due to liability issues. And not only just liability for the patient, but liability to the employee, and then liabilities to, for example, if they're using a lift to get them out of their car, there's also damages that could possibly happen. So there is that limitation, but my focus of my project was to see how we can go around that. And I think for me, it just made me bring new eyes to the project. A lot of people were like, well, we can't do anything. But for me, I just recently had a meeting on Monday and they said, this is fabulous work. Thank you for providing all the resources. Now it makes it easier for us to take the next step, whether it be helping our patients get that transportation paid for or partially paid, or just letting other people know that these resources are available to them.
So you might feel due to the circumstances of where you are working and your preceptor, as well as what you bring to the table, but your circumstances were different. So do you feel like you made a contribution?
I feel like I definitely made a contribution. And the fact that my internship was extended, my preceptor wants me to see this project go all the way through, not just data collection, which I ended up making a data collection form for San Leandro. And then to my surprise, I was being asked by Fremont Kaiser Permanente to use that form, which I didn't really expect to happen, but it did. And the one thing I forgot to mention earlier is that I work for the greater Southern Alameda area, and that includes San Leandro, Hayward, Union City, and Fremont. So I'm working for all those 4 organizations. So anything that we pilot in San Leandro is going to be implemented in the other Kaiser Permanentes.
Okay, well, that's great. And Deja had mentioned that, she felt like she didn't have quite as much opportunity to focus on a contribution there. It's one of the things that I recommend that students think about, and you may want to do, then ask in your interview, is at the end of this internship, will I truly feel like I made a contribution here? Because sometimes having interns is just as new to the organization as being an intern is to you. So you can help guide them by asking those kind of questions up front. Will I feel like I made a contribution at the end of this internship? Okay, so.
One more thing onto that.
Sure.
So my preceptor asked me, what do you want? What do you want to come out of this internship? Like, what do you want? So I would suggest that when you're doing that interview, to tell them what you want. Exactly how you said, Professor Troidl, but tell them what you want, because that way they will try to see and find opportunities for you to actually get to achieve that goal or what you want to do.
Yeah, and if I might suggest a little bit different way of wording that is to be able to articulate your goals for the internship, okay? Because focusing just on what you want, that may not be compatible with what they want. And if you do have some flexibility, it's good to identify that. But if you focus on goals, hardly anybody finds that offensive.
I think with HCC, they had mentioned it at one of our conferences about situations of things you shouldn't do. So an intern turned down an offer because it wasn't clinical, but HCC was willing to negotiate with another organization to actually give her that clinical experience she wanted. Yeah. So in a way, it's okay to tell them what you want. I would say that if you do apply to HCC, to do it earlier on, during the HCC internship, before you go into your interview with the host sites.
Right. So let's move to Aaron. So You and I know how you heard about HCC. Why don't you tell the world how you heard about HCC?
Yeah, so I was studying abroad in Barcelona in the fall and checking my Santa Clara email, and like same as Deja, really got a email from the public health department, and because a little background about myself is that I am a psychology major and then created my own, like also like Deja, healthcare management major my sophomore year. But I came in as a public health minor, so I'm also on the public health list, which again, if anybody out there is thinking about creating their own major, I highly recommend it, because I think that in itself, and Deja can probably agree that in an interview that looks really good because it shows a lot of initiative and passion, and it was a really great experience for me to meet a lot of professors at Santa Clara. But being on that public health list is really helpful because you do get kind of more targeted emails and opportunities and event reminders and stuff like that.
Right.
But yeah, so I had applied to that, and I will say about HCC that it's a very slow process. So I submitted my written application in the fall when I was studying abroad, and then it wasn't until I was like, well, then I had your class in the winter and told you that I applied for it, and that's how I found out that you had a personal connection to it, and so you really suggested sticking with it.
Right.
Because I would say most internships, like, you want to know about early spring if you have the position, and HCC does this weird thing where you apply written, then you have an interview with the organization HCC, and then you get up to 3 interviews. You have to do each of the 3 interviews. You rank the organizations rank you because they each have a couple of interns. They match you, but that whole process can take up till May, which is pretty late, especially when the semester system. Luckily, we were on the quarter system, but I stuck with it, and I'm glad. I was looking for other things too, but this ended up being the best opportunity. But a lot of the reason why I stuck with it was because you had said it, we just really raved about how great it was. But yeah, definitely like.
And I didn't lead you wrong, did I?
No, you didn't. No, yeah, it's been a really good experience, and I think that part of the strong suit of HCC is that there is this like larger network, and I think I can speak more about that. They have these site tours that they like you to do, and this year our coordinator didn't quite get those together because there was some stuff going on, but they said instead we want you to conduct some informational interviews, and posted a list of all of the HCC interns in Northern California and the organizations that they work at. So I was able to look through. I chose to look at the South Bay ones because that was more realistic for me, but there's a lot in East Bay because a lot of Berkeley kids do this program. But yeah, I just had an informational interview the other day with someone who works at like managing a clinic at Sutter Health, and it was just like so incredibly helpful. And so I did that. I interviewed with like just a bunch of informational interviews. So it's a really good network to be part of, especially when it's a budding program at Santa Clara.
Yes, and we hope it expands at Santa Clara.
Yeah.
And just before we leave the point about how you found out about it, so the listserv is good. So the moral of the story is make sure the public health department knows who you are. And then I was working it on both sides, suggesting to you to hang in there. And then because I professionally know the HCC people, contacting them and saying, hey, you got a good one here. Keep moving. She's got some other options, and you told me, and that was helpful to me.
Yeah.
You told me about some options you had, so I went on the internet and I sent him an email and said, hey, she's got some other options, so you guys need to get going.
Which I think goes back to that informational interviewing too, because everyone says it's like network or not work, I think is Jeff's thing. And and it's true. I think that like just knowing you, having you as a professor and you knowing him, that helped me get this internship, and now having this internship will hopefully help me network further to get a job. So I think it does kind of, once you get the ball rolling, it's really helpful. Yeah,
that's the fun part about networking. It just keeps going and going. Yeah. So what was the title of your internship?
So technically I'm just a student intern, but I'm working with the quality management department at Valley Health Plan, which is the county health insurance plan. And basically what I'm doing is working on, there's this organization called NCQA, which is a national accreditation agency for health plans. And so I'm writing this 40-page long report about how our health plan is coordinating our medical and behavioral health services. And part of the reason I think that worked out so well for me, that I was matched to that organization, is because I'm also a psychology major, so I have that behavioral health background and did a little bit of research at the Ethics Center here last year.
What year are you again?
I'm going to be a sophomore.
Okay.
or sophomore, senior.
Oh,
I wish I was gonna be a
Wow.
sophomore. No, yeah, that was, I guess it's too real, but yes, I'm gonna be a senior.
Yeah, Aaron, I was gonna ask you how you did that, because
Yeah.
if you can step back a couple years in time, I want to learn
Yeah,
how to
I
do
wish I could, but no, I'm ready.
that.
Yes, I'm gonna be a senior.
Yes. Okay, so what did you work on? Well, you told us the title, nice long title. It's a little bit of a complicated title.
Yeah,
So what'd you work
so
on?
basically my project, so there was one other intern at Valley Health Plan, and I have to say my preceptor is really great. She's had interns for the last couple of years. And like I said, the 2 interns last year work there now. And so she's really great. But we did, my fellow intern is pre-med, and so he did the coordination of care between medical services, like ER, primary care, that sort of thing, and wrote a report and did a survey on that. And mine was medical and behavioral health care. And so there's 6 different factors of excellence, essentially. And so we would collect data, and sometimes it's through a survey, sometimes we go into the electronic health records and do chart audits, which is a huge thing in quality, which I learned it can be kind of challenging though.
Chart audits?
Chart audits,
Yeah.
yeah, because I think a huge theme for me has been data about my internship, because I wasn't really aware of that before. But for example, like how well is the primary care practitioner and the behavioral health practitioner sharing information about their patients? Or if a patient has diabetes and depression, how are those diseases being co-managed? So a lot of my internship was deciding how we were going to attack each of those factors and what we were going to measure, and then the methodology for collecting them. And so now I'm working on the conclusion finally. It's been like a huge project, but I'm working towards the end, and so I'm helping on some other like piecemeal projects as well. But
So the kind of classes that we've been surveying about, and I mentioned that the healthcare quality management classes seem to be a popular one. Do you think that would be helpful for you?
yeah, I think that because I didn't really know what quality was so much, I got a little bit of exposure in management of healthcare organizations, and that was really great. And there was this whole thing about metrics and measurements, and we use that all the time, so it's totally relevant.
Yeah.
And so yeah, I think quality would be a great one. There's a lot of HCC internships in quality. I also think health data or health IT, that's huge, because that's really up and coming. We have a consultant working with us, and that's her thing. And I think that that's a very good tangible skill to come out of Santa Clara with.
Well, you know, it's interesting that you mentioned that, because I'm thinking of modifying the survey to include that class, which is a little ironic that I didn't, because when I graduated from business school, I went to work for a HIT company, consulting firm. It's like, I was asking myself recently, John, why did you forget to put that on there?
Yeah.
So thank you for bringing that up. So you think it'd be good to ask on the survey?
Yeah, and I think when somebody was saying that quality and data go hand in hand in Newsdasia, and that's so true. You can't do anything in quality without first like measuring it and collecting data, like Daisy said she was doing. So.
Yeah, and I mentioned the survey in particular because Aaron and another student, Matt Randolph, were 2 people who basically helped encourage me to do it, and offered to be helpful on it, and here she is being helpful on it.
Oh, I'm glad it's moving in that direction.
Yeah,
cool.
there you go. Okay, so what else would you like to share about your internship? Was there anything you didn't like?
Yeah, I mean, I think, so for me, when someone asks me what I want to do, I know it's health management, but I don't always know further than that, like what one issue, and I love behavioral health, but I don't know if that's the one thing, or if it's going to be health systems or health plans. So there's a lot of variety, and I think part of the cool thing about being in a health plan, especially like Valley Health Plan, because it's very affordable and most of the county employees are on it. It's like zero copay if you're an employee of the county.
Well.
And so I think that that's kind of that social justice aspect of this internship, and I think all of the HCC internships have an element of that. But I think, and when you're the payer, you have certain capabilities because you have access to a lot of data. But it can also be, it's hard to see the outcomes of your work sometimes. I know that in order to stay as a health plan, we need to get accredited, we need to turn this report in. But I'm never going to meet the doctors, I'm never going to meet the patients who this is affecting. I'm not going to be able to be there for the intervention elements.
Yeah.
And so I think part of working at a health plan is it's very high level, and so you can't really be on the front lines seeing what you're doing. And you know, sometimes writing a report's not super glamorous. It's just sitting at your desk and writing. We have a lot of team projects to discuss it,
but I heard you lay in there a very important public health concept, which is getting to outcomes.
Yeah.
And that is one thing in public health that we add to the equation.
Right.
Because while a lot of people are being process oriented and doing the medical care and doing the medical care and doing the medical care, sometimes losing sight of the fact that we need to get good outcomes.
Right, and I know they'll get there, I just won't get to be there for it, and I think that's
Yeah.
part of just being there for 10 weeks as an intern, but,
Yeah.
so yeah, that's something that moving forward, I'll look forward, maybe in the early stages of my career to be able, because I think that's a little bit more inspiring when you can see that happening.
Yeah.
And they'll be able to see it through the data later, hopefully,
Yeah.
but yeah, that's definitely something I've learned.
Yeah, the outcomes add a lot of satisfaction to
Mhm.
the professional work. So is there anything else you wanted to add?
I think that, I don't know, for me, and I was also, I think you guys talked a little bit about how, I know, like, coming into this summer, I was thinking, okay, so I know I love healthcare. I don't know exactly where in healthcare I want to be. I don't have necessarily like a financial background or a clinical background. And I was thinking, okay, so why would the healthcare industry want me?
Good question.
You know, which is a hard question to ask yourself. You've got all this like knowledge about community health. I think that's Santa Clara is really good about that and that social justice aspect and social determinants of health. But what hard skills are you going to bring to the field? That's really important.
Yeah.
And I think for me, I think that informational interview aspect of career searching is just really important and finding good people who will mentor you. Like I had a business professor who I was also asking for advice when I was applying for this internship.
Yep.
And when I ended up telling her that I was placed here, she said, "Oh, my sister is an executive in the county health system. You should meet." And so she and I met, and she's been great. And just really everyone I've talked to is just so willing to help and share their story. And I think every person's story that I hear really helps me kind of, that inspires me, or I want to follow that path. So
Yeah.
just talking to people is huge.
Well, it's one of the nice things about working in health and public health. It's basically most of the folks you run into are good folks.
Yeah.
Yeah. So, okay, thank you. Deja, did you have anything else you wanted to add as we wrap this up?
Only that, you know, at all of our internships, we're getting exposure to the professional environment and professionalism, which I feel like, you know, you have the education from Santa Clara, but how are you a leader in the workforce, or how do you work in a team, not in a class project? And, you know, you really get to see professional systems work and how managers lead their teams, how meetings operate, how deadlines work, how you advocate to a higher up for your, wish and dream or improvement. So just the professionalism of an internship, I think is just invaluable, whether it's from HCC or through a different avenue.
Excellent. Daisy?
I would just say, I mean, I don't know, I think for you guys, your internship might have been a little different, but for mine, be creative, don't leave anything off the table. Someone might not have seen that idea that you had and might actually be the way to fix things. In my case, that's what's going on. What I suggested is actually being implemented, something that I thought I would never see through. And I might see it till the end of my internship, but I would say just be creative, but don't go too far. But don't leave any ideas off the table that are plausible.
Okay, so I have one more question to ask.
And then we should ask Karen if she has any questions.
You bet. I asked Taylor before she left, but she had to go. And I haven't asked you this question, but some of it is frankly a response to some of your explanations and to what I know about you. And it's conditioned by knowing that you three worked in large institutions, so it may not be quite as relevant, but did any of you find that language skills were helpful to you in your work?
Yes, so I'm fluent in Spanish, and actually that turned up with the new project I'm working on, which is video interpretive services at Kaiser Permanente in San Leandro. And they were making a survey that has to be in English and in Spanish. And one of the people working on the project said, I need to get this translated, so I can't do it right now. You're gonna have to wait, you can't make the survey. But to her surprise, I actually translated it for her, and I said, here you go, save time, there you go, you don't have to wait. So I would say, yes, it's very beneficial. knowing another language if possible. Go towards the ones that are very popular. I would say English and Spanish. Those are where most of your patients are. Chinese or in Tagalog. So I would say that's very beneficial to have.
Yeah, and Deja, you said you're a Spanish minor.
Yep, and actually a pain assessment survey that I'm working on with patient experience. We walk into patient rooms actually, and some patient families are Hispanic and only speak Spanish. And when you're administering the survey, I have just, I don't want to say I rehearsed it, but I definitely practiced.
Rehearsing's not bad.
Rehearsing isn't bad, but without that background, I mean, where would I be, in my rehearsal? I would literally be having to write down, translate every single word. And if there's a question, it's like, oh, I didn't rehearse that. Yeah. So, I think I would say, especially if you're in California, Spanish is a huge asset to.
Great. And Erin?
Yeah, I mean, I'm not a Spanish minor, but I'm an international business minor, so I did take a lot of Spanish, the intermediate series, when I lived in Barcelona for a quarter. My host mom didn't speak English, so I got my fair share of Spanish speaking experience. I haven't used it at my internship, but I guess this isn't quite related to the internship, but I did an ELSJ here at Santa Clara, and it was with the Washington Elementary School population, and they're pretty much all only Spanish speakers.
You get to speak Spanish every day.
Yeah, and I was a translator, and it was a really great experience because we wouldn't have been able to do anything. So, but yeah, a couple of my interviews did ask me if I spoke Spanish, and that was important to them. So.
Okay, good to know. All right, Karen, do you have any questions for the panelists?
I don't think so. I think you guys covered pretty much everything. I really just wanted to have an idea and see what you guys got out of it and just how it works in general. It was really inspiring. That was really good. Very helpful.
Yeah, and Karen had told me in Brazil they don't have the same kind of internship system. So you are her entire familiarity with internships here. So thank you, all three of you, very much. I thought it was terrific. You did a wonderful job, and thank you for sharing this with other students at Santa Clara.
Thanks for signing us up.
You're welcome.